Okay, so my talk is about how antidepressants work. As you probably all know, antidepressants have become increasingly popular ever since the introduction of Prozac and its cousins in the late 1980s and early 90s. And right now, antidepressants are high up there in the top 10 of most commonly prescribed psychiatric drugs. However, at the same time, scientists have increasingly started critiquing antidepressants, saying that they are often no better than placebos and actually may do more harm than good. Among these scientists are several well-known psychologists as well. For example, Irving Kirsch and Richard Bentel. So psychologists like Kirsch and Bentel have argued that the efficacy of antidepressants can be explained better by psychological factors than by biological factors. Specifically, Kirsch has argued that patients' expectancies play a major role, and Bentel has argued that key to treatment success is actually the quality of the relationship between the patient and his healthcare provider. So the more warm and collaborative the relationship, the better the patient does. So Kirsch and Bentel are very much in favor of psychological explanations of how antidepressants work. And I can actually go a long way in agreeing with people such as Kirsch and Bentel, because yes, prescription rates for antidepressants are very high. The diagnosis of depression is very common. But at the same time, I still think that biological effects of antidepressants are being ignored too much. There's a large body of literature on the biological effects of antidepressants, and I think, well, what is the purpose of my talk is to convey to you the idea that antidepressants have biological effects that cause in the brain, that cause changes in interpersonal behavior, can thereby improve social relations, and as a result of that, lead to mood improvement. Now, the very early ideas about how antidepressants work is that the very early ideas were purely biological. So Prozac and its cousins were shown to increase serotonin neurotransmission in the brain, and therefore thought to work by restoring brain serotonin levels back to normal. However, antidepressants were found not to work right away, but it usually takes a couple of weeks. So these biological theories have become more complicated over time, and currently one of the proposed mechanisms is that antidepressants, whether they acutely increase serotonin or dopamine or norepinephrine, also cause additional slower changes in the serotonin pathways of the brain, and it's these slower changes that ultimately explain why people start saying that they feel better. Nevertheless, they're still purely biological theories. So how do you explain that biological changes in the brain cause people to report psychological changes, which is that they start feeling better? This sort of brain-to-mind gap has been open for quite some time, but in the past decade or so, especially a group of neuroscientists and psychologists at the University of Oxford has started looking into this. And they have developed what they call a neuropsychological theory of antidepressant action. And so the basic premise is that depressed patients tend to be very good at picking up these negative expressions, such as when people look angry, sad, or fearful, and they're not very good at picking up happy expressions. So they have an emotional bias, and they're more likely to pick up negative cues in favor as opposed to positive cues. And you can imagine that this emotional bias has an impact on how depressed patients feel and behave. So the Oxford group, led by Catherine Harmer, has done a series of experimental placebo-controlled studies showing that even a single dose of an antidepressant can make people worse at picking up the negative emotional expressions and better at picking up positive expressions. So the idea behind their theory of how antidepressants work is that gradually there's a reduction in the emotional bias, and people first implicitly, without actually realizing it, but with repeated antidepressant doses, also at a more explicit or conscious level, start noticing more positive things in their environment, and this is what contributes to their mood improvement. So the theory actually does a quite good job at explaining the lag of onset of therapeutic action as well. So I think this is very much the first theory that has tried to say, yes, antidepressants have psychological effects, but we also shouldn't be ignoring the biological underlying effects. This has been corroborated with brain imaging studies as well. Nevertheless, I think the theory is still limited, because the studies that were conducted are all laboratory studies conducted with tasks that required people to simply look at these types of faces and label the emotions. And I think what has been forgotten is the communicative value that facial expressions such as these have for people in their everyday lives. So for example, if I'm seeing a person looking scared, my behavioral response might be to either avoid that person, or I might approach that person in an attempt to help. It also, of course, will depend on who this other person is. So what I'm arguing then is that rather than only looking at the effects of antidepressants on facial emotion recognition in laboratory settings, we should also be studying the effects of antidepressants on interpersonal behavior in everyday life. Now, I haven't actually conducted any of these studies of the effects of antidepressants on interpersonal behavior, but I have studied the effects of tryptophan on interpersonal behavior. And tryptophan is an essential amino acid. You need it in your diet, and your brain needs it to be able to produce serotonin. So by giving people extra tryptophan, you can increase their brain serotonin levels. So the effects of tryptophan and antidepressants on brain serotonin levels aren't all that different. What is different is that tryptophan has much fewer side effects. So I've been involved in 3 studies of the effects of tryptophan on interpersonal behavior. People took tryptophan and a placebo for 2 weeks each. They reported on their naturally occurring social interactions for this entire time period. And at the end, they couldn't reliably tell what they had been taking. But there were effects on behavior. And specifically, we asked people about 4 different dimensions of behavior. So people got questionnaires, and they were asked to, for example, say, on the right, I do the same thing. They were asked to say, for example, that they complimented the other person. They were asked to whether they showed impatience towards another person. That they showed impatience. They were asked whether they asked the other person to do something, or whether perhaps they didn't say what they were thinking. And we consider these examples of friendly behavior, unfriendly behavior, dominant and submissive behavior. So in the first 2 studies, people who were taking tryptophan started reporting fewer unfriendly behaviors and more friendly behaviors. So effectively what happened is that their social interactions, their social relations became more warm and collaborative. And this is very much reminiscent of what Richard Bentel said, who I mentioned in the beginning of my talk, who said that warm and collaborative relations are very important to therapeutic success. Let me think. Okay, so in the first 2 studies, this is what we found. And what we ended up doing, which is my PhD advisors and we last year published a paper on what we call an interpersonal theory of antidepressants. And the idea is basically as follows. We try to incorporate our findings and those of Oxford by saying that apparently drugs that increase serotonin in the brain can have a positive effect on the behaviors of individuals. So on interpersonal behaviors, which is what we showed, and also on interpersonal perceptions, which is what the Oxford groups showed, and actually we had some data on this as well. So what we're arguing then is that drugs that increase serotonin might make depressed individuals better at receiving messages from others, and also at sending messages to others. And if I'm a depressed patient, and I've been sort of having this negative outlook on the world, but I start taking antidepressants, then maybe, I see others in my environment in a slightly more positive light over time. This may lead me to be a bit more friendly towards them. And I think crucially, if I'm more friendly towards someone else, maybe not initially, but after an amount of time, if I'm consistently this person, others might start picking up on this as well and become more friendly towards me. So what effectively happens then is that social relations can improve. I feel that my friends are suddenly a lot nicer towards me, and this might contribute to my mood improvement. So this, I think, is a sort of more updated version of a psychological theory of how antidepressants work that doesn't neglect the biological effects. Okay, So you might think I'm done, but in fact I'm not. I haven't discussed the last study, and it came with a twist. My PhD student, Koen Hogenels, recently completed the third study in people with depression in their immediate family. And what he found is that participants who he gave tryptophan as well started feeling better during the social interactions, which is what we had found before, so this was not unexpected. But actually what happened at the same time is that they became more unfriendly and less friendly towards others. And this was totally unexpected. So clearly what happens is that, when you increase serotonin, it's possible that interpersonal behavior changes in one direction, or it might change in another direction, but in both cases it can lead to people to feel better and improve their mood. So I guess our theory got more complicated as well. But I actually think it became more interesting at the same time, because imagine that you start giving people antidepressants, and they start feeling better. And some of these, one group of patients actually has improvement in social relations, as I showed that could happen, but another group does not have this kind of improvement. You can imagine that the second group is much more likely to actually relapse after a longer period of time. So I guess this is what I wanted to say. The idea is basically that there are psychological effects that antidepressants have, as well as biological effects, and I think the two are more interrelated than you might have thought. So let that be the take-home message. Thank you.